Our patients are disproportionately affected by a variety of key health and social conditions, including diabetes, cancer, obesity and overweight, hypertension, HIV/AIDS, community violence, limited access to fresh, healthy foods, and exposure to environmental hazards. Whittier works with community partners to incorporate social determinants of health into our overall services. Whittier is recognized as a center focused on empowering and activating patients so they can be better engaged in self-management and attain improved health. Our culturally competent services and patient navigation and case management approach to comprehensive care helps patients control chronic conditions and maintain treatment adherence.
Just again, so what do we do now? Okay.
In the Pediatrics Healthy Weight program, we focus on nutrition, on behavior modification, on self-esteem issues, and teach them about healthcare and physical activity.
What? They put this in salsa. You get to choose.
Pink.
You want pink?
First, we cut some things up. We put it all in one bowl. We started mixing it and stuff. So then I took some chips and I crumbled them in and I mixed it up and I ate some. It was really good. Whittier Street is the best place I can go to, and like Whittier Street can be like it can be like this special place. It's like a dream where you get to do whatever you want here.
The focus of Project Me is on HIV prevention. We recently opened a drop-in center in Dudley Square to reach out to people who don't typically come to a clinical setting to access healthcare, so we can provide healthcare out in the community.
When I walked up in there for the very first time, it made me feel like home. I felt welcome. I felt like a burden was lifted.
Staff at Project Me reflect the community, so when somebody comes into the drop-in center, they see familiar faces, they see people who have gone through some of the same struggles as them, and they are easily able to connect to staff in order to access services at the drop-in center, and then to eventually access services at Whittier when they're ready.
I would recommend anyone to access and utilize service over here at Whittier. I'm here every day, just about every other day. I'm basically always over here.
We serve Roxbury, and we have amongst the highest rate of infant mortality, of low birth weight, and premature delivery in the city.
Everybody has different experiences throughout their pregnancy, and that's pretty good to learn about other people's experience, especially when I'll be the first time mom.
The goal is really for a woman to begin to take charge of her own body and her own health care, and to see herself as in charge of her pregnancy and her health.
My doctor is Dr. Holland. That's my doctor, and she, I always call her for any information, like if anything's wrong, and she always got answers for me, and if I'm not feeling well. We have a really good relationship. I really do like that about this clinic.
The group is led by a facilitator, but the women really develop a support system amongst themselves and really help each other. It really shows the universal process of pregnancy. It crosses all lines.
I've been coming to Whittier Street Health Center for 54 years. Whittier Street's a good place to come, and people are nice here, and they treat you with politeness and things. But the main thing I come here for is my eyes and my primary care. I come to Whittier Street for. I go to Dana-Farber from the cancer and anything else.
Dana-Farber and Whittier Street Health Center have a shared vision to address cancer disparities in low-wealth and minority communities.
Dana-Farber is working on improving the outcome for all cancer patients, and to address disparities in cancer outcomes and cancer care, we're engaged in a number of initiatives. We know that people from different geographic locations and different ethnic groups have different forms of cancers that otherwise look the same under the microscope. African American men are 2 to 3 times more likely to die of prostate cancer than men from other ethnic groups.
Like I'm over in Dana-Farber, and last time I went was November. It came back .01, so that can't get too much better than that. So hopefully I'll jump up for joy one day.
Because demand for our primary care services continue to steadily increase, we're in the process of constructing a brand new state-of-the-art patient-centered medical home in Roxbury. At approximately 80,000 square feet, our new health center will double the capacity of our current location, allowing for increased community reach and services, including a community cancer clinic to bring cancer care directly to those most in need, and an urgent care clinic to reduce the inappropriate use of emergency rooms. This new building will give us the capacity to provide up to 220,000 visits annually to address wellness and prevention.
Whittier Street Health Center is a great resource for the Roxbury community. The CEO, Frederica Williams, is a visionary, and she has really put together a wonderful set of programs there. And we think that by partnering with Whittier Street and with her, that we will be able to gain better trust of the community, to get their input and have them teach us what we can do better to address their needs.
This long-standing partnership with Dana-Farber will be expanded in our new building, where we will have a fixed mammography unit, expanded services for survivorship, and a community cancer clinic that will help us to address the cancer disparities that plague the communities we serve.